Let's get to some more health headlines. COVID cases are on the rise as a new variant is spreading known as Stratus. In fact, according to the CDC, about 1 in 10 people who test for COVID is positive. So Dr. Natasha Bouillon joins us once again. You know, a lot of people are thinking, oh, is COVID still a thing?
Yeah.
It's not talked about a whole lot, but apparently cases are increasing even here in Arizona. Why is that?
It's still around, and Arizona is one of 12 states where the COVID test positivity rate is climbing. And in Maricopa County in particular, we have the highest number of COVID cases that we've had since January. So it still is a factor. And one of the driving factors is the Stratus variant.
Yeah.
It's basically a variant of 2 Omicron variants. And so it's a new variant. It's nicknamed the razor blade variant. And the reason why is because when people get it, they have a really severe sore throat. I've had patients that say it feels like they're swallowing glass.
Wow.
And so even though the symptoms are more transmissible, the good news is it's not more severe. It's not resulting in more hospitalizations. It's just leading to more cases.
Okay, so should people do the same thing? I mean, do we need to mask up all over again?
So we don't need to universally mask, but it is good. It's a good idea to make sure that you stay at home if you're sick. And I tell that to people with any respiratory illness, cold, flu, COVID, stay at home if you're sick. Make sure that you rest and recover, and then you don't get people around you sick. The other thing that is important is you should test for COVID when you have symptoms. And the reason why is there is a treatment for specifically COVID with Paxlovid. And so if you're eligible, it makes sense to get tested and understand if you need to get that. Wash your hands, stay at home. I think those are the best kind of practices for people.
Okay, back in the day, I feel like we had to stay at home for a week.
Yeah.
Is that still something?
So in terms of isolating, we do tell people to stay at home. There isn't official guidelines on quarantine or isolation, but I think in general, it's a good idea to stay at home while you have symptoms.
Okay, so we are entering into the fall season. This is where we've got cold, flu, I mean, all the
RSV.
illnesses, everything.
Yes.
So, I mean, what should we know about heading into fall?
So going into the fall, we know that there is going to be an updated COVID vaccine that comes out. We're waiting for official guidelines from the CDC. Right now, the CDC is recommending that all adults over the age of 18 should get a vaccine. In particular, people who are older adults or people who've got chronic conditions, they should get a vaccine. I think from there, the guidelines are starting to diverge because the American Academy of Pediatrics said that folks that are 6 months to 2 years should get vaccinated. The CDC said there should be no universal vaccines for children. And so ultimately, I think the best advice is to talk to your doctor if you've got questions about the vaccine, but we're waiting for more guidance.
Yeah, they know you best. All right, let's get to another health headline making news. The latest study on GLP-1s reducing the risk of cancer. Tell us about this study.
Yeah, this was a large study looking at over 80,000 people over 10 years. And what they found is people that were taking GLP-1s for weight loss actually had a 17% lower risk of cancer compared to those not on GLP-1s. In particular, it was endometrial cancer as well as meningiomas and ovarian cancer. What they did find was a non-statistical increase in kidney cancer, but that could be by chance. And so the FDA has not put out any warning with kidney cancer and GLP-1s. But ultimately what this is finding is there's clearly a link between weight, inflammation, potentially insulin resistance, and cancer, and GLP-1s could be beneficial for cancer. We certainly need more research.
Yeah, but that's very promising.
It's very promising.
Okay, let's keep talking about GLP-1s. Eli Lilly says after successful results in a phase 3 clinical trial, it expects to submit a GLP-1 weight loss pill for FDA approval by the end of this year, and that pill could hit the market next year. Now, I was reading when it comes to weight loss, this pill apparently does not have the same effect as the injections. Why is that?
Yeah, that's correct. So there's actually already a GLP-1 pill for diabetes. This will be the first pill for GLP-1 for weight loss. But we do know that the pill is not as effective as the injection for weight loss because the injection has different absorption, it has higher absorption, and it bypasses the digestive system. But that being said, there are other benefits to having a GLP-1 pill over an injection.
Okay, and what is that?
Well, cost is one of the benefits. We don't know what the cost is, but we know it'll likely be less expensive. Another benefit is that the GLP-1 injections faced shortages, and we know oftentimes pills don't face as many shortages, and so there could be other benefits and reasons that people want to take the pill, and we know that cost was a huge barrier for the GLP-1 injections.
It still is.
Yes,
yeah.
exactly.
Okay, good stuff. All right, thank you so much.
Of course.
You've been so great just analyzing so many things from the valley fever all the way through all of these topics.
Yeah, so we'll have to wait for more research on that GLP-1 pill.
Yeah, no kidding. Dr. Natasha, thank you so much.
Thanks.